Thank you, Val, for inspiring us with your story. And thank you, Dr. Del Riviero and Dr. Duma, for your excellent presentations. In this final section, we're discussing research, advocacy, and support. So let's hear from each of you. What would you say to a NET patient in regards to NET research, patient advocacy, or support? Dr. Hendifar, let's start with you.
Yeah, thank you, Lisa. I think it's very important that our patients get involved in advocacy. It's really important that we support LACNETS, that we join together in these meetings and do everything we can to help the community at large. So, please support LACNETS as much as you can.
So I'm going to focus a little bit on NET research. I think there's a lot of very innovative research that's going on, whether it's clinical trials or more patient-related outcomes research as well. My most important advice is that timing for clinical trials matters a lot. So really take advantage and talk to your providers to figure out what is the right time to go on certain types of clinical trials and really, take part with that to make sure that the timing is correct. And you sometimes don't want to wait until it's very late or later on to go on a clinical trial. And sometimes going on a clinical trial earlier might make a lot of sense for your journey.
Yeah, so speaking of clinical trials, it was very instrumental in my treatment. And I just wanted to kind of share that aspect of mine. So I actually started a clinical trial 7 years into my diagnosis. And I'm proud to say that 9 years later, I'm still on the same treatment protocol and with stable metastases. So as much as clinical trials can be useful at the beginning of a diagnosis, you should keep an open mind and open communication with your doctor to see if there are trials available to you as your treatment progresses or your cancer possibly progresses as well, because there's options all along the road.
I'm going to speak in regards to patient advocacy in the sense of you'll quickly learn through this process that, and especially living with something as rare as NET, that you will become an advocate. And through that path, you learn that advocacy is something that you learn to do, and that you realize that through your own need for being an advocate, that others need advocacy. And advocacy incorporates research, support, and education. And that's what it means to be an advocate for yourself and for others. And I'd like to hand this kind of topic over to my dear friend, Mary, who's going to share a little bit more about what it means to advocate for yourself and for others.
So I am proud to present the Monica Werner Award, annually presented to a patient, a supporter, or a caregiver who inspires the NET community with passionate involvement. The awardee embodies the passion, dedication, and leadership and the spirit which Monica Werner assisted patients, caregivers, and families affected by NETs. If any of you, and I know many of you have had the pleasure of knowing Lisa, you know that she embodies all of this and more. This award comes with a $10,000 donation from AAA to a patient-focused charitable organization, which Lisa has graciously requested to be given to LACNETS. Our LACNETS family and the larger NET community are so incredibly proud of Lisa and grateful to her for all she has done. Congratulations, Lisa, on winning the Monica Werner Award this year.
Thank you. Thank you, Mary, and thank you, all of you. You're going to make me cry. So I'm going to show you the award. And this is such an honor, and it's especially meaningful to me since 2020 was a year of transition, not just because of the pandemic, but really especially after the loss of our dear friend and founder, Giovanna Joyce Mbesi. I take very seriously my promise to her to carry on her torch, as I know many others do as well. And I know Giovanna would be so proud of what we've been able to accomplish together. So thank you all for being part of this community and for helping carry on this torch. Thank you so much. So now we're excited to introduce our final set of speakers. Dr. Hendifar, take it away.
Yeah, very honored to present Dr. Pamela Coates, Chief of GI Oncology at Yale University. Her talk is titled Net Research, What's on the Horizon?
Thank you, Dr. Hendefar. And I'm excited to introduce NET caregiver Gilda. She is inspiring because of how she's walked alongside her husband. And for our Spanish-speaking audience, Gilda's story, along with her husband's story, which was broadcasted earlier, along with the presentations by Dr. Suarez, Dr. Del Rivera, and Dr. Duma, are also available to view in Spanish on our website, lacnets.org/Spanish resources.
And I am very happy to introduce our dear friend as well as colleague, Josh Mailman, who many of you know. Obviously, Josh has played an integral part in the patient advocacy community and runs the NorCal CarciNet group as well. In addition to that, he advocates on behalf of all NET patients in the role of clinical trials in the NCI as well. So really a big part of our community, and honored to introduce him. And he'll be talking about patient advocacy and support.